Hello, welcome back to another fun episode of Thrive Live, where we believe it's better to cultivate health and to cover up symptoms, and that your health gives you the power to reach your full potential and thrive. I'm Dr. Jenny Abercrombie, naturopathic doctor and founder of the multi-state naturopathic wellness center clinics. Thank you for joining me today and for making Thrive Live a weekly habit to elevate your health. So when patients come to see me for HPV and cervical dysplasia, the diagnosis commonly triggers a deep mission for them. We are not just looking at reversing a precancerous condition, but looking to live life truly well. When you get the big pre-C diagnosis, it tends to make us question how we are living and what we risk to lose without taking action. So today I want to talk about what needs to be in place beyond the localized treatment of the cervix, so that we can help treat HPV, help the cervix actually heal, and help HPV not be recurrent. We're going to talk about the orchestra that makes up the robust vaginal vault, the immune system, and a vital, healthy body. So let's first talk about making a robust vaginal vault. So there's many strains of lactobacilli, and there's certain strains that will develop a stronger, more resistant, robust ecosystem, and others that will be more sensitive and welcoming to pathogens, so we don't want in the vaginal vault. So probably the healthiest lactobacilli strain is Lactobacillus crispatus. It produces a high amount of D-lactate vaginally, which helps to maintain that healthy ecosystem. It builds a strong resistance to colonizations of the other microorganisms, so yeast, HPV, STDs. It's kind of the most robust lactobacilli you can have. Alternatively, Lactobacilli minors is not as strong of a species. It can't produce the D-lactate, which helps maintain that vaginal ecosystem. So it makes it kind of welcoming for the pathogens to colonize. And we can sometimes tend to see that those with Lactobacillus minors are going to have an increased risk for HPV, bacterial vaginosis, vaginal dysbiosis, HIV, herpes, right? It's a little bit more of a welcoming lactobacilli strain. Lactobacillus rhamnosus is one that will actually inhibit yeast, so inhibit candida growth vaginally. It's actually resistant to spermicides. It will also help to adhere to the urinary cells and kills pathogens through biofilms. The great thing about Lactobacillus rhamnosus is you can actually colonize your vaginal and urinary ecosystem by actually taking it orally through a probiotic. And lastly, Lactobacillus fermentum will produce the hydrogen peroxide that will help to maintain the ecosystem. It will also adhere to the urinary cells. It will also infiltrate biomes, be anti-candida busting and anti-gram-positive bacteria. So it's very similar to Lactobacillus rhamnosus. So the reason why I wanted to go into those species of lactobacilli is because we can test it. Medical diagnostic labs is one that I like to do on patients who have HPV or cervical dysplasia, or just want to know what their vaginal biome is looking like. And it's one of the only labs that I know that will actually then go and test out the subspecies of lactobacilli so that we know what we're working with. Now, when it comes to treating the vaginal vault, that can be its own other discussion. But kind of my big takeaway here is don't forget about the gut, right? The gut ecology is the root to the vaginal and urinary ecosystems. So when I see a lot of chronic HPV, chronic bacterial vaginosis, chronic candida, chronic urinary tract infections, we want to go and treat the gut biome and because that is, even though it's a separate ecosystem, actually seeds the other ecosystems. So don't just ignore the gas, the bloating, constipation, reflux. They can be signs that your biome is off. Next up is stress management. Stress is really important when it comes to HPV because stress activates the herpes family of virus replication. So if you have any herpes family viruses, stress is going to be a big activator of the RNA replication. And so when I talk about stress management, sure, that can mean deep breathing sessions and doing yoga and going for walks, but really there's so many different ways to get to the top of the mountain when it comes to doing your what type of stress management will work for you. And the other thing too is it can be really hard to ask our brains, are we stressed? Because our brains will adapt based upon what traumas we had in our earlier years, our childhood, nature, nurture, genetics, the work. So it is where the limbic system and the amygdala change our prior exposures in life so that we respond to stressors today based on all of those factors. So stress management can definitely be its own huge category of things. But at least just taking the first step of being very conscious of and having frequent check-ins with yourself throughout the day to try and just de-stress, release that stress gas so that we're not building up. Diet is a very big one when it comes to our vaginal health. The diet that we want for cervical dysplasia and to help our immune system to fight HPV is going to be very fiber rich and eating the rainbow of vegetables and fruits. So we want all of those colors in there. That's where we're getting our antioxidants. And we want to be cleaning up the diet and cutting out processed foods, sugar, alcohol, dairy, and really going in and focusing on that nutrient dense food. It's almost like 70% veggies, like real vegetarian, and then bringing in the protein and the good fats. Sleep is huge. When we get into a deep quality sleep, we release healthy levels of melatonin. Melatonin is one of our immune system's biggest antioxidants. This deep phase of sleep is also where the body will spend its time resting, detoxifying, and repairing damaged cells. So we can't get out of the chronicity cycle of chronic viral infections, which think of HPV as like a chronic virus, without maintaining adequate sleep. One kind of quick tip to help your sleep is wake up at the same time every morning, and then bedtime hygiene. Do a technology fast an hour before bed. Kick out the phone, TV, any lighted device. Those can disrupt your sleep cycles. And then also you can always pick up a pair of blue light glasses. That's what I got. And especially if you're on a computer and screens all day long. Next is balancing the estrogen. And the reason why I put this below everything else is because the diet, stress, sleep, those factors all help to improve your estrogen progesterone balance. The reason why we want to improve estrogen balance is because estrogen dominance will drive cellular replication of the cervix. So it's going to kind of propagate the dysplasia on the cervix. So some of the signs of estrogen dominance could just be PMS, breast tenderness, painful cramps, the clots, the dark menstrual blood. I really want to see a bright menstrual blood, not dark. These are all signs of having too much estrogen in relation to the progesterone that you have. In regards to estrogen balance, there's so much to do in the lifestyle and hydration and stress management and sleep. Supplementally, kind of the first place where I go is DIM. Taking DIM as a supplement, at least in the doses that I give for cervical dysplasia, is equivalent to eating about 10 pounds of broccoli in a day. So DIM, yes, it will be in your cruciferous veggies. As a supplement, we're trying to just basically crank the dose. Other supplements that I find helpful, AHCC from the antiviral component, folate to help with methylation, which is your DNA replication, which is going to be used for repairing your cells, repairing your immune system, having healthy functioning biochemistry. Now, not everyone can handle high doses of folate, so that's something definitely to talk to your doctor about. And of course, vitamin C. So the HCC, DIM, folate, and C are kind of like my baseline. And then on top of that, we'll blend in whatever other supplements that particular individual needs for their systems to function better. So do they need more help in the hormone and the estrogen balance? Do they need more help in the sleep arena? Do they need more help in the stress arena? Do they need more of the probiotics, and do we need to go fix the gut? So we really want to take that bigger lens of looking at the orchestra in the body and not just whatever localized cervical treatment you need. And that will help to prevent the chronicity of HPV, right? Because HPV can come back, and it will help your immune system be able to fight off the HPV and also improve your or improve your risk factors, reduce your risk factors for other lifetime diseases. So thanks for tuning into Thrive Live, where we believe your health gives you the power to unlock a life of fulfillment. If you enjoy this episode, please invite your friends to subscribe to Thrive Live. You can also follow me on Instagram to continue the conversation. So we'll see you next week.